All right, let's jump right in. We're going to be talking about a really powerful medication called Baclofen. Now, this isn't your everyday muscle relaxant. It has a very specific, very targeted job to do inside our central nervous system. You can think of it as the body's ultimate off switch.
But, to really get why we need an off switch, you first have to ask this question. Imagine for a second what it would be like if your muscles were getting a constant, relentless signal to tighten up, with absolutely no way to relax. It's a really serious and often debilitating problem.
And that right there brings us to the core issue that Baclofen is designed to fix, a situation where the body's own signals start to misfire badly. That condition has a name. It's called spasticity. It's basically a state of constant muscle tension and spasms that happens when those signals in the central nervous system get completely stuck on go. The best way to picture it, and this is a great analogy, is to think of a car's accelerator pedal being jammed all the way to the floor. There's no brake, just constant, uncontrolled power. So, if spasticity is the stuck accelerator, then what you need is something to cut the fuel line, right? And that, my friends, is where Baclofen comes in. It's the calming agent designed to step in and take control. And here's what makes it so different. Baclofen is what we call a centrally acting muscle relaxant. This is a crucial point. It means, unlike a lot of other medications, it doesn't work directly on the muscle itself. No, it goes right to the source of the chaos, the body's command center, the brain, and the spinal cord, to quiet down all those haywire signals. So how does it actually pull this off? I mean, how does it find and flip that off switch inside the incredibly complex wiring of our nervous system? Well, the science behind it is actually pretty elegant. It really all comes down to one molecule, GABA. The easiest way to think about GABA is as the main brake pedal in your brain and spinal cord. Its whole job is to slow things down, to inhibit nerve signals and stop them from firing too often. It's the body's natural, hey, just calm down command. But here's where things get really specific, and this is cool. Not all brake pedals are the same. See, our nerve cells have different kinds of receptors, which are like different locks for GABA to fit into. A lot of common drugs, like benzodiazepines, for example, they target the GABA-A receptor. Baclofen is special because it's a key that's been designed to fit a very specific, very different lock, the GABA-B receptor. It's incredibly selective. So by hitting those specific GABA-B receptors, Baclofen launches this kind of three-pronged attack to calm the whole system down. First, it suppresses those overactive muscle reflexes in the spinal cord that are causing the spasticity. At the same time, it slams the brakes on the release of the go signals, things like glutamate, that are telling the muscles to contract. And finally, it basically just quiets down the nerve cells themselves, making them much less likely to fire in the first place. It's this all-around approach that really makes it so effective. Okay, so we've got this super powerful off-switch mechanism. Where do we actually use it? Well, Baclofen has a really fascinating range of uses. Some are official and FDA approved, and others are a bit more, off the books. So its main gig, the approved job, is treating severe spasticity from conditions like multiple sclerosis or spinal cord injuries. But then you look over at the right column, and it's used off-label for things like chronic hiccups, which, when you think about it, makes sense. Hiccups are basically an overactive nerve reflex, which Baclofen is perfect at calming down. It's even been used, pretty controversially, for alcohol use disorder. These off-label uses just go to show the drug's incredible potential to quiet down all sorts of overactive signals in the body. Now, this is a seriously powerful medication, and with that kind of power comes a very strict set of rules. The safety side of Baclofen is something you absolutely have to take seriously. As you'd probably guess from a drug that's basically hitting the brakes on your entire central nervous system, the most common side effects are things like drowsiness, dizziness, and fatigue. It can also cause some muscle weakness, which can be a tricky thing to balance. You want to reduce the spasticity, right? But without losing so much strength that you can't function. So, to manage all of that, doctors follow a very strict mantra when they prescribe Baclofen. You always start with a tiny dose, and then you increase it very slowly, gradually, over days or even weeks. The whole goal is to find that perfect sweet spot. You want the maximum benefit with the absolute minimum side effects. But as you can see from that very last step, how you stop the medication is every bit as important as how you start it. In fact, that last point brings us to what is, without a doubt, the single most important rule when it comes to Baclofen. If you only remember one thing from this entire explainer, please let it be this. You can never, ever, ever stop taking it abruptly. Your body gets used to the drug's calming effect. It adapts to it. So if you suddenly rip that away, the entire system can rebound with a vengeance. And I'm not exaggerating. This isn't a suggestion. It's a life or death warning.
And this is why stopping suddenly can trigger a terrifying cascade of severe symptoms. We're talking seizures, hallucinations, extreme confusion, high fever, and a return of the spasticity that's even worse than it was to begin with. It is a true medical emergency that needs immediate help. The dose has to be tapered down slowly, always under a doctor's care. And beyond the withdrawal, there are other really important warnings. Since it's cleared by your kidneys, anyone with kidney problems needs a much lower dose. Mixing it with other depressants like alcohol or opioids is incredibly dangerous because their effects can pile on top of each other. And of course, it goes without saying that it can seriously impair your ability to drive a car or operate machinery safely. So at the end of the day, Baclofen is this incredible tool that can literally give people with severe spasticity their quality of life back. But it's also a powerful agent that demands respect and really careful management. It all leads to this fundamental question in medicine, right? How do we balance a drug's incredible, life-changing benefits against its very real and sometimes very scary risks? Finding that perfect balance, well, that's a critical conversation every single patient and doctor needs to have.